So, as a busy emergency physician, we are seeing that ladder falls are contributing significantly to the load experienced by emergency departments and by the inpatient teams in the hospital. So, for example, over a 5-year period, New South Wales Health spent over $50 million on ladder-related injuries, and over 57,000 procedures were performed as a result of ladder falls. Ladders are actually the most dangerous piece of DIY equipment that we use around the home. They are responsible for the greatest number of accidents around Australia. And so a fall from a ladder can have devastating consequences. So you might be lucky and get away with it. Actually, what we find is that 85% of the patients who present to hospital after a ladder fall end up being admitted. So that's usually for a good reason, because they've broken their ribs, because they've got a serious head injury, because they've got spinal cord damage, or some other reason. So these are serious injuries involving a long period of recovery in general. So that could be a lengthy stay in the intensive care unit, there could be operations performed, the patient might need to go to rehab for a long period of time, it could be several months until the patient is actually ready for discharge. A fall from a ladder can significantly impact your career because you could lose your job. So if you are seriously injured falling off a ladder, you may not be able to work, particularly if your job is at all physical. It does tend to have an impact on the family as well. So if you fall off a ladder and you live down on the south coast, for example, you may need to come to a major trauma centre. That will involve your family having to travel up and visit you for the period that you're in hospital. But it also means that once you go home, your family is going to have to look after you. So they may need to help you with such basic activities as getting dressed, eating, washing, going to the toilet. Most people don't want to become a burden in that way. You need to treat ladders with respect. So ladders are potentially a dangerous piece of equipment, like a lawnmower or like a chainsaw. And there are certain guidelines that can help you to use a ladder safely. The other thing to say is that as we get older, you're more likely to fall off a ladder for various reasons. You're more likely to be injured if you do fall off. And if you are injured, it's going to take you much longer to recover from those injuries. So if you're over 70 or if you have a medical condition, think seriously about whether you could get someone else to do your pruning or clean out your gutters or whatever it is. So I think the key safety tip is if you are going to go up a ladder, have someone there to help you. So have someone to hold the ladder, and also pay attention to the weather. It's not a great idea to go up a ladder when it's wet and windy. You're much more likely to fall off. Look, if you are by yourself, you may be lying there for hours before somebody finds you. So think about asking the person who may be looking after you if you do fall off, your wife or another family member, for example. Just do the sensible thing and just ask for a little bit of help just at the time that you need it. That will prevent you needing a lot of help down the track. So be responsible, use a ladder safely, think about your family. Just take it seriously, whatever the height of the ladder.